Thank you very much. So I'm going to speak first. I'm Dawn Horton and I am the network manager for Shine. I'm just sharing slides now. Hopefully you can see those.
Yes, thank you.
Okay, so we're going to talk about using data effectively in schools to support mental health. So I'll begin by explaining what Shine is. So the Schools Health and Wellbeing Improvement Research Network is the full name for Shine, and it provides an infrastructure which facilitates collaboration between health researchers, schools, and the wider educational and health communities. We have a particular focus on supporting the collection of health and wellbeing data in schools, and we provide school-level health and wellbeing data reports to schools which promote a systems-level whole school approach to improvements in wellbeing. So we currently have 259 Scottish schools network, which is spread across all 32 local authority areas, and that represents approximately 130,000 children and adolescents. And despite COVID, or perhaps because of COVID, the network has almost doubled in size since March this year, and it's still growing. So we believe that Shine has huge potential to provide an excellent data platform for children and adolescents' mental health going forward. So in Scotland, the data landscape for health and wellbeing in schools is very varied. Schools are using a mix of surveys, some created in-house, inventing their own questions. Some are using commercial packages, which might not necessarily fit the Scottish context. And some are collecting individual pupil data to identify pupils who are struggling, but that data obviously then can't be shared. So with the school level Shine reports, we are encouraging schools to use validated research questions and promoting aggregated data which can be shared with the wider school community. So initially, when we began, we were using data from the HBSC Scotland 2018 survey. And the first school level Shine reports provided schools with a research context for each health topic, with accessible data tables that schools could use, which were benchmarked against national or regional data. We provided schools with practical examples of a whole school approach, and also a directory of relevant resources and training. And on this slide, you can see that there were a variety of approaches used across schools, and having the network really gives us the opportunity for this good practice to be shared Scotland-wide across the network. You can see videos of the Shine school case studies on our website, showing how various schools have used their data. So last year, we carried out case study work in 4 local authorities to have a look at the school level reports and how they'd been used. So this was done in 4 local authorities, 4 secondary schools and 4 primary schools to see how the schools had received these reports. So we spoke to a wide range of people, from pupils to teachers to senior leaders, also with health and wellbeing contacts and data analysts in the local authorities. And the reports were very much welcomed by schools who found them very clear, comprehensive and accessible. In particular, they liked the gender split in the data and the ability to benchmark the school's data against the regional improvement collaborative data. They also welcomed very much the access to research expertise. And you can see there's a quote from a head teacher who commented that it would have taken her 5 years to get near this level of report, and that she really appreciated the benefit of having a skilled professional, a researcher, compiling these reports. So the feedback from the case studies, particularly the barriers that were identified, informed Shine's next development, the mental health survey. And the barriers centered very much around the small sample size. Schools were dubious about using evidence from such a small sample, and they were keen to have more support with the interpretation of the data. So I'm now going to hand over to Judith, who's going to tell you about the mental health survey.
Okay, thank you. Yes, so in response to this feedback, we developed the Shine online pupil mental health survey. And this was very much designed as a broad measure of mental health and provided to schools as a flexible resource. So that is that we put together all the documentation information for schools. Sorry, could you go back? Thank you. So we put together all the sources and documentation for schools and made it available to them, but it was up to them if they wanted to take part and for them to choose when and which pupils they would like to administer it to, obviously with guidelines attached to that. And in return, schools received a school level report. Given that the first reports were well received, we stuck to quite a sort of similar structure to that. So we provided background information on mental health in young people, simple data and figures and tables and broken down by year groups and gender. But in particular, we decided to have a bit more information on the mental health measures that we were using, how to interpret them, providing national benchmarks and cutoffs where we could, and also trying to just explain a little bit about the limitations of those measures as well. And in addition, to help with the interpretation, we provided some challenge questions. This was to help sort of guide discussions within the school and to try and give them some pointers as to how they could look at and approach the data. These reports are now automated, so we're in a position that we're able to provide reports within a few days, within a week of the school telling us that they completed survey collection. So that's obviously great, because that was also something that they came back to us saying that they wanted to be able to have their data back pretty quickly. And obviously we had to take into account sort of small schools as well, so and not identify individual pupils. So in some schools are able to have a combined report with another school within their cluster. So if you can move on to the next slide. Thanks. So what does the survey measure? So as I said, we really tried to go for kind of a broad idea of mental health. So there's a survey for older primary school children and a survey for all secondary school children, but they pretty much measure the same things. So we're looking at mental health problems, so emotional and behavioural difficulties, as well as low mood. We're also looking at subjective well-being, so that's happiness with 11 different areas of life. So that's very much, this measure was kind of, a lot of these measures were selected so that they would be meaningful to schools and useful in their work with people. So the well-being one looks at different areas, so schools might be able to look at that area and say, oh, we're scoring particularly low in this area, maybe we need to try and help our pupils with it. We also have measures of positive mental health. So we have a survey looking at social emotional health survey, which may not be a mental health outcome in itself, but obviously these are factors that contribute to good mental health. And it's also, again, areas that the schools might be able to look at and see, oh, we should work on those particular areas, or our pupils are kind of a bit weaker in these particular areas compared to others. And obviously we want to give this mental health data a bit of context. So we also ask questions about sleep, which again is a topic that schools are very interested in, and also things around the school experience. So yeah, next slide, please. Thank you. So the response so far, so we launched the survey in mid-September, and so far we have around 4,000 pupils from 33 schools taking part, and that's going up each week. And we're pretty pleased with this. We know schools are interested in data, but we weren't quite sure of the uptake of this, because it's something that we're not pushing schools to do. It's a resource that's open for them to take part in if they want to. And obviously there's been a lot of disruption with COVID. And we've not really had time to look at the results in depth. So this slide here is just showing you an example of one of the figures that could be in a school report. So this is showing the results from all secondary school pupils that we have data on so far, and it's showing a percentage at risk of depression. And as you can see there, it's by year group and also split by gender. And the little symbols there are the sort of data, the national data that we have from the 2018 survey, which they can use sort of for some benchmarking. Next slide. Thanks. And just sort of summary. So basically the survey is still open. So we're hoping and do expect more schools to take part. And we're also asking schools for feedback to find out how they found the survey, how they find the data report. So we're kind of wanting to continually improve what we're doing and how to sort of best offer the support and also encourage data use and good use of data. And obviously it's also good for us as researchers. It's sort of a win-win situation we're here in, and that we have a good data set to work with. So in time we'll want to look at sort of this dual aspect of mental health, so looking at sort of mental health problems and subjective well-being, and also kind of this idea of developing mental health profiles. So looking at sort of trying to join all the measures together and seeing if there's areas where where pupils have strength and also where there's distress. And obviously in time there's thoughts to obviously have some data linkage, and obviously the potential, as Dawn is saying, the network keeps on growing. There's the potential to develop this as a platform for mental health data.
Thank you very much indeed, ladies. That's